Hello everyone, Assalamu alaikum. My name is Dr. Rifzana Fathima. I'm the specialist in internal medicine at Naseem Medical Centre, Wakrah Branch. Today we have with us Dr. Eswar Moparty. He's our consultant gastroenterologist and he'll be talking to us about a few common gastric complaints that a lot of us face in our everyday life. So without much ado, we'll start off with the questions. So doctor, since I've been working here, most common complaint patients come to me with is gastritis, some heartburn or gases. So can you tell us a little about what is gastritis and what is acid reflux?
Sure. Gastritis is inflammation of the mucosal lining of the stomach. The gastrum is the stomach. So the causes of gastritis can include an infection with a bacteria called as Helicobacter pylori, or it can be because of medicines such as alendronates or painkillers such as brufen or diclofenac, or it can be because of ischemia, or it can be because of spicy acidic food or reactionary changes. So these are the causes of gastritis in general, but the symptoms of gastritis include bloating, belching, burping, acid reflux, water brash, that is a feeling of salty water coming into the mouth. And they can also include more serious complaints like difficulty swallowing or pain on swallowing or bleeding from the stomach or the upper GI tract, which manifests as blood vomiting or as black color motions called as melena. So these are some of the symptoms of gastritis and acid reflux.
Okay, so basically I think everyone's familiar with the symptoms, but the things that people should be scared of or take notice of is this blood in the vomitus or the black colored stools.
Black colored stool or also severe abdominal pain, especially in the upper abdomen.
Yes. Okay. And so, doctor, you mentioned about Helicobacter pylori. So, I've noticed that it is very common in this area.
Yes.
Can you tell us, like, is the symptoms different, or how do we diagnose? What should we do for diagnosing this case?
Helicobacter pylori is basically a bacteria which lives in the stomach, in the mucosal lining of the stomach. It can cause hyperacidity or it can cause hypoacidity by what is called as chronic atrophic gastritis. So basically it causes this gastritis, inflammation of the stomach. It can cause peptic ulcers either in the stomach, in the esophagus or in the duodenum, which is the first part of the small intestine. It can cause bleeds and it can also cause precancerous conditions such as they are called as dysplasias or metaplasias, gastric metaplasias. And this has to be diagnosed with, either the stool test for H. pylori antigen or with a urea breath test or with an endoscopic biopsy. And the treatment options for Helicobacter pylori include a combination of antibiotics such as amoxicillin, clarithromycin, or when there is clarithromycin resistance, metronidazole can be used. Or if a patient is having allergies to penicillin group of drugs or to amoxicillin, then they'll have to take what is called as a bismuth, tetracycline and metronidazole combination. And all these things they have to take it with proton pump inhibitors, which are medicines such as pantoprazole or Nexium or esomeprazole, these kind of things.
Yes, so we understand that it's very important that we diagnose these cases of Helicobacter because they can lead on to serious conditions like ulcer and even precancerous situations. In our medical center, we have the stool H. pylori testing, and doctor is now conducting endoscopy with the biopsy to find out about whether it is present in the biopsy sample. So coming to general gastritis, if a person is having gastritis, is there any tests that they should undergo to diagnose gastritis or acid reflux?
The tests that are helpful for gastritis, acid reflux, first they include the basic tests such as a CBC, where we check for the hemoglobin. Because if they're having an ulcer and they're having a leak, they'll have a low hemoglobin.
Yes.
A stool for occult blood, which checks for blood that is, in the urine, which in the stool, which they cannot see with the naked eyes. Also, stool for H. pylori antigen. or the urea breath test for diagnosing the Helicobacter pylori infection and taking the necessary treatment. In addition to these, there are some specialized tests such as a 24-hour pH metry. So that test measures the amount of acid reflux that is coming into the esophagus over a 24-hour period. And there's another thing called as high resolution manometry. That test checks for swallowing difficulties, when there are swallowing difficulties such as achalasia or motility disorders, then the pressure that is there in the esophagus is checked with this high resolution manometry. In addition to this, there is what is called as a barium swallow test and a barium meal test, which is a radiographic test where they take x-rays after giving the patient a barium containing fluid to swallow. These are all the tests, and in addition to this, the most important test is the upper GI endoscopy, also called as the esophago-gastroduodenoscopy, where we check for the problems which may be there in the esophagus, such as narrowings called as strictures or polyps or ulcers in the esophagus, which is the food pipe, and also for a condition called as Barrett esophagus, which is a precancerous condition because of acid reflux. So these can be checked. And in the stomach also we check for polyps, gastritis, gastric ulcers, erosions, and also any masses or cancers, whether they're early gastric cancers or full-fledged cancers of the stomach. We also check for hiatus hernias, which are basically, there is a muscle called as the diaphragm, which is in between the which separates the chest cavity and the abdominal cavity, and it has an opening through which the food pipe passes. When the opening becomes enlarged, the stomach goes up into the chest. That is called as a hiatus hernia. So the grades of hiatus hernia as well are checked with endoscopy. And also we check for the duodenum, where we check for these ulcers as well as for diseases like celiac disease, where there is an abnormality in the mucosal folds. And these are the ways to diagnose the various gastritis, gastroesophageal reflux, and associated conditions.
Okay, so I think he's already explained to us in detail the tests, and he's told us specifically about a test called endoscopy. So endoscopy is otherwise known as a camera test, where they insert a small tube with a camera, which helps us to diagnose this case. You've already told us about hiatus hernia. Once we understand what the diagnosis is, how is the treatment from there?
For the hiatus hernia, basically what we do is, when we do the endoscopy, we check for the grades of the hiatus hernia.
Yes.
There is a grading system called as Hill's grading, which is from 1 to 4. And if it is on the higher grade, like 3 to 4, first for the basic grades, like the grade 1 and grade 2, diet, lifestyle, antacids, and then proton pump inhibitors, prokinetics. These are the medical, there is a medical management for that. But if it is a higher grade, like grade 3 or 4, and there is a severe acid reflux or the after effects of acid reflux such as Barrett esophagus, then what we do is, in addition to the medical treatment, we also consider surgical management with what is called as a Nissen fundoplication. That is a laparoscopic surgery where the upper part of the stomach, also called as the fundus. The fundus is wrapped around the lower esophageal sphincter, and this prevents the acid reflux coming up. That is called a Nissen fundoplication. That is considered when the hiatus hernia is very big.
Okay, so doctor, you've explained about hiatus hernia, but I was just hoping you would explain about generally the gastritis, that is what the most people are facing. What are the medications we give for that case?
For gastritis and acid reflux, the medicines that we give are classified into proton pump inhibitors. The first line therapy. Proton pump inhibitors basically inhibit the hydrogen potassium pump, which causes acid to be secreted in the stomach. So they can include medicines like pantoprazole, esomeprazole, rabeprazole, and there is another group of medicines which decreases acid that is called as histamine receptor antagonists. They include famotidine. Then prokinetics are also used, which push the food from the stomach lower down. They include medicines such as etopride or domperidone. And there is another group called as alginates. These coat the inside of the esophagus and the stomach, and they decrease the acid pocket which comes up. So they are taken as a liquid form after food, and then they float on top of the food layer and decrease the acidity because of the acid pocket. Now another group is there which is called as a mucosal coating agent called sucralfate. So that also helps in coating these ulcers or erosions. This is the medical management. And the other part of treatment of gastritis is treatment of the complications, which can include endoscopic treatments. Like for example, there is an ulcer which we find on endoscopy, and if it is bleeding, then we'll have to treat it with either electrosurgical methods such as cautery, or we'll have to clip the ulcer or the bleeding blood vessel. If there are some dilated veins which are bleeding, they are called as varices, then they will need an endoscopic treatment called as banding or glue injection, endoscopic glue injection. Also, these gastritis and acid reflux, they can include the spectrum of precancerous conditions, and if they are found by biopsy to be precancerous, any particular lesion, then it has to be removed with what is called as endoscopic mucosal resection. That is an endoscopic way of removing that gastric patch, or endoscopic submucosal dissection called ESD. And an after effect, a serious after effect of acid reflux called as Barrett's esophagus. If that is there, then it has to be treated with an endoscopic modality called as argan plasma coagulation, where we burn that mucosa which is having the precancerous potential. So these are some of the ways to treat gastritis.
Alright, so doctor has explained about the medications we can use and the endoscopic treatments that is available. But we're also interested in knowing about some diet and lifestyle modifications that everyone can incorporate in their daily practices. Can you shed some light on that, sir?
So the diet and lifestyle plays a huge role, a very important role in control of gastritis and acid reflux. First, among the lifestyle factors, colas have to be minimized. Then a person should avoid smoking and alcohol. And the other thing is they should avoid a sedentary lifestyle, because a sedentary lifestyle causes obesity, which causes increased intra-abdominal pressure and increases the propensity for acid reflux. And among the dietary factors, H. pylori is spread through food, water and saliva. So if a person is not sure about the hygiene of where they are eating, they should avoid eating at such places, rather consume fruits or eat at a place where they feel safe that it is hygienic. Other thing is, if they are having any lifestyle diseases like diabetes, diabetes can cause what is called as gastroparesis. That means a decreased motility. So the acid reflux is higher. So they should consume smaller quantities of food and maybe take food for more, like instead of small frequent meals, instead of eating 3 heavy meals, maybe distribute it over 5 times in a day. And the other thing is they should also avoid these spicy, greasy foods, and also maintain a food diary. If they're having excess of flatulence, bloating, acid reflux, or gastritis symptoms, they should maintain a food diary where they should be mindful of what food they are eating and what after effects they are causing. For example, if they are having intolerance to gluten or intolerance to lactose or milk or dairy products, or to beans or to cauliflower or such things, they should make a note in that and try to avoid them or eat minimal quantities of such
because
foods.
It's very specific for each patient, and only they will know what is causing the problem. Yes. Okay, so that has brought us to the end of the discussion, and it was a very useful one, I believe. So I'd like to thank Doctor, and thank you for tuning in.